It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Hi, and welcome to Eyespiring. I'm Heather Patrick, your host and the CEO for Prevent Blindness Texas. So, we do a podcast to talk about eye health and to raise awareness of all the pieces of health and life that connect around vision. And then to talk about and get different perspectives of how vision is a part of what you do. So today we are super excited to have Nurse Melissa Summers, who has a unique connection to PBT. And I'm really excited to get to know her more and for her to share her story because I think it's just a testament to the power of one person. And also just how our lives intertwine, maybe when we least expect it. So, Melissa, please give us kind of your bio and then we'll dive in.
Hey. Well, hi, my name is Melissa Summers. I'm the district nurse here for Venus ISD. I earned my LVN in 2015, and then I went into pediatric home health soon after that. In 2016, I got the opportunity to become a school nurse, so I jumped on it. And so I started working actually at the primary school then. I continued my education after that and ended up going back to nursing school in 2023. I joined the Bridge to LVN to RN Bridge program. I graduated, and while I was there, I actually got the opportunity to meet Angela from Prevent Blindness Texas, and she came to our clinical group and taught us all how to use the spot screeners, taught us all how to use the chart. We became certified vision screeners there, and then we actually did clinicals in Fort Worth ISD and helped her screen so many students in just one day. It was actually the most amazing thing I've ever seen because I had been a school nurse for so long already and I'm used to doing vision and hearing screenings, but just seeing how PBT went in there and got all these students screened, got them referred, and just so quick, all in one day, it just really blew my mind. After that, after I graduated in 2023, I actually got the opportunity to become a district nurse here, and I jumped on that. And I immediately emailed Angela and Prevent Blindness Texas and asked them to come and help in our school district because I knew we definitely needed the help.
Yeah, that's awesome. So, what inspired you to become a school nurse? I think it is a special calling, and we love our school nurses. But what inspired you? What made you decide, yes, this is where I want to be?
I think I've always known I wanted to be a school nurse pretty much since elementary school.
Really?
One of those frequent flyers, somebody who was always in the nurse's office.
Yeah.
I actually had migraines, so I had to go in and get my
Mhm.
medication every once in
Yeah.
a while when I had a flare up. And I just always felt safe and understood in the nurse's office. I never felt ashamed to go in there or like I was ruining somebody's day by going in there. And so I knew I want to be that person for somebody one day, just a safe space.
Yeah. Yep. I love that. My oldest, she was a frequent flyer too, and that her elementary school nurse was amazing. And so and of course, we work with nurses all across the state, and just school nurses are such an important part of the system. Um, so, how has your career path from pediatric home health to labor and delivery to school nursing prepared you for your current role?
I think when I was doing pediatric home health, I really saw how health challenges can affect an entire family.
Mhm.
I remember I had one patient that I worked with who had a very complex medical condition, and I just remember going in there and seeing how her family was very exhausted and overwhelmed.
Mhm.
And so I knew that I needed to be there not just for her, but also to support them. So
Yeah.
that taught me really communication and compassion. And then when I was in labor and delivery, that you just learn to remain calm in any situation. I mean, there's times you're going in and you're having to flip and flop a mom because the baby's heart rate is decelerating, but you have to be that calm presence and reassure her and try to keep her calm. So that definitely taught me just to be a steady, calm presence, like in a storm
Yeah.
situation. So
Yeah.
I think those really just helped me with my patients and my problem solving and how to be resourceful as a school nurse.
Yeah. That's great. Um, what makes school nursing unique compared to other areas of nursing, or even the field? I mean, in your mind, why is it a little bit different?
I think it's different because you're really just the biggest difference I would say is the independence and the relationships that you make. I feel like in the hospital, you have a whole team of people that can come in any minute, but in the school, you're often the only medical professional and you become the first line of care. So it's just, you just make a big difference and make special relationships in school nursing. You just get to see kids grow up.
Well, that's a great point. I didn't really think about that, right? But you do have that unique view because you're seeing them the entire time they're in school.
Yes, yes.
Yeah.
Like I started at the primary and now I'm at the high school, so I'm starting to see them cycle back through, and it's really cool to see them grown up.
Yeah. So what's the difference kind of even in school nursing from being at the elementary level to the secondary level, especially in high school?
I think there's not a huge difference. Their little bodies have become bigger. So I think their personalities remain the same and their needs remain the same. But the high school, I would say the primary campus, it's more Band-Aids and ice packs. And then at the high school, it's more emotional, talking, communicating, trying to figure out what the real problem is, why they're coming in.
Yeah, that's great. That's great. What keeps you inspired during the hard days?
Definitely the kids. It's definitely the kids. I mean, even when I'm buried in paperwork or I have tons of kids in here, it's just nice to be that person that I know they can come to and I'm their safe space. So I just always want to be their safe space, be there for them in any situation that they're having.
Yeah, that's amazing. What was one of the best pieces of advice you received kind of through your journey that shaped you?
I think it's just really taking the time to think about the situation that you're in. And because you can have a student come in and they just have a stomach ache, but they've come in every day with a stomach ache. So you really have to sit and think, I don't think they have a stomach ache every day. So you start asking questions. Well, why does your stomach hurt? What are you going through? Something is something stressful. So it's really just that my advice was given to me was just to sit and listen. Just listen.
Yeah. It's amazing how listening can change so much, right?
Yes.
Just listening. So on the flip side, you've been doing this for a while. What advice would you give for, one, somebody who might be interested in nursing, they're really thinking about their path, and two, maybe a nurse that's newer in her career. What advice would you give them?
I would say make sure nursing is your calling because it really isn't for everybody. A lot of people go into it because they think this career is gonna put me on a lot of vacations. I'm gonna make lots of money. I'm gonna be able to do this, but it's really a career where you have to be very empathetic and you have to be compassionate. And if you're not somebody that you're not empathetic person, it's really not for you. So just really figure out yourself and then decide, does your personality really match nursing? And is that something that you feel like you could do? Because it can be very stressful and very overwhelming for somebody. And if you can't adapt to that, then you won't make it for very long.
Yeah. 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 And so what helped you as, when you were a new nurse, when you were young in your career, kind of what helped you, kind of align, or I don't know, just keep you going in the sense of not necessarily what inspired you, but how did you keep determining, okay, so I want to go from LVN to RN, right? How did you make that decision? Like what prompted you on that?
But really just educating myself. I knew going from LVN to RN, I was going to get a little more nursing knowledge. We were going to dig deeper into processes and how things work. I was going to be able to open up my skill set and do more things. I really just think that's it. Just that.
Yeah. Yeah. All right. So let's talk a little bit about vision specifically. So for those that may not know, tell us what a day in your life looks like as a district nurse.
It could really be, I could start out my day just with a line of kids. Like they have headaches, they woke up sick, they don't want to be here. So I'll process all of those. And then I usually go through and see, do I have any screenings I need to get done today? Vision and hearing screenings, scoliosis screenings, anything like that. So I'll try to schedule those. But you get little emergencies sprinkled in all of the time. So you could go from training a student in CPR, staff and things, and then getting called away because somebody's having an anaphylactic reaction somewhere, or I have a student with a chronic medical condition like diabetes who now needs some insulin administered. So it's just, your day is never the same. Every day is a surprise.
And is that sometimes comforting or is it sometimes like really challenging?
It's
Maybe a
really,
little bit of both.
yeah, it depends on how the previous day was. But I really enjoy coming into my job and knowing that not everything, I'm not going to have the same day I did yesterday.
Yeah. Yeah. For the good or the bad of it, right?
Yes. Yes, either way.
Yeah. How do you balance immediate health needs like injuries with preventative care like screenings, right? Because you have to take care of both. How do you balance that?
I think balance is one of the trickiest things, but it's also one of the most important things to being as a school nurse.
Yeah.
On any given day, I mean, I could have immediate care needs, just like before, tons of headaches, stomach aches, people coming in. But at the same time, I know preventative care truly makes a big difference. That means I have to schedule my vision and hearing screenings ahead. I have to keep up with all the immunization paperwork. I have to educate kids about hygiene and nutrition. Um, it just, I don't, while balancing all that can be challenging, I think immediate issues are like a doorway to preventative care. So
Yeah.
like if I have somebody come in with headaches and they've been struggling, they tell me I have a headache every day during this period when we're doing this. Well, let's check out those eyes and see maybe there's something going on there. So I think screenings and preventative care and all that's really important together.
Yeah. Yeah. So what are some of the biggest challenges you face today as a school nurse?
Um, I really think mental health has really become a huge thing in school nursing, especially moving up to the high school. I see that a
Mhm.
lot more. I've had several students come in and it's just like a stomach ache, but after you talk to them for a little bit, you're realizing that they have a lot of anxiety or they're going through something super stressful, and that happens a lot more now.
So with that, how do you partner with parents then? Because I would think that's an important key to this.
Mhm.
And I know on the screening side, it definitely is, right? Because they're the gateway to the next step.
Yes.
So, what have you found to be successful in working with and partnering with parents?
Definitely phone calls. Don't just send the referral home or a letter home or tell the kid, make sure you tell mom and dad this. It's really getting on that personal level with the parents and reaching out to them. Make sure you're making that phone call. If you don't get a hold of them, leave a message and then try to call again, either at the end of the day or the next day. It's just making that connection and communicating with parents.
Yeah, yeah. And do you find throughout your career, have parents been receptive? Do they, how has that been received?
A lot of the time they are very receptive and they're very open and they're very appreciative that you actually took the time to reach out to them and call them and communicate with them.
Yeah, yeah. So you became a certified vision screener.
Mhm.
Um, so why? Why did you? What made you think? Okay, I want to do that. I want to learn. I want to do that. Or was it because it's just you knew you had to as being a school nurse?
At first, it really was because I knew I had to.
Yeah,
But becoming a school nurse, that's something that you have to do. You have to perform those screenings.
yeah,
But then going back to 2023, and when Prevent Blindness Texas came into our class, we learned how to use everything. And then after that training, volunteering and just seeing that was just, I knew like when I go back to the school, I have to get this in there. And I'll never forget that experience, just watching how quickly those screenings could be done and how seamlessly all those kids were referred and how those families were immediately giving resources to help them get those
mhm,
classes. It was just like powerful, but just so simple. Like taking that little screening and turning it into something that you're going to make a difference and you're going to get help for those kids. It was just, I knew I wanted to bring that here.
yeah. That's awesome. That is really awesome. It is. It's interesting, right? Because most people hear vision screening and they don't think twice about it, right? They don't. know or understand the power of that screening, and how it truly can change a child's life.
Yes.
Um, it certainly changed mine. I was part of the screening process in first grade. And of course, I had no idea because I didn't know what I didn't know. I didn't know how I was supposed to see. So I had no idea there was an issue until I got screened
Yeah.
and failed the screening, right? And so it's a simple process, um, but one that is well coordinated.
Yes, very much.
Yeah, but it takes a lot of different partners
Yeah.
and people as part of that process, right?
Yeah.
So, as part of that process, have you do you think your parents understand the process? Have you educated them on it? What are some of the most, you know, what are the usual questions you get from parents related to vision screening?
Um, One of the big ones is, does my student need to bring their glasses to school if they already have glasses? And
Really?
yes, I said, I'm always surprised to get this. And I'm like, yes, they should actually be wearing them every single day, especially if they're prescribed glasses.
Yeah.
That's a big one. Another one is, do they have to have the screening? Because
Mm,
they're not sure what the screening on entails. Like, is my student going to be touched? Do they have to, is there going to be a big machine there? Is it going to be scary? And so a lot of times they'll opt out because they're just not sure. So we'll send out a notification, usually at the beginning of the school year, letting our parents know we're going to have this screening. This is how it's going to work. Please make sure their glasses are with them,
mhm.
and just kind of talk them through just so they know what to expect. And then
Yeah.
we do have parents that will call and, hey, can you tell me what the screening, like, how does this work? And we'll just walk them through it. And then they'll be like, oh, yeah, please screen my kiddo.
Good.
Yeah.
Good. Good. Now, do you have parents that are also trained and certified, or any of them that have expressed interest in helping you?
We do have some that have expressed interest. We also have a high school class here that
Mhm.
volunteers in some of our classrooms, and they've actually become interested in becoming certified vision screeners to help us during the school year.
Awesome.
So we're hoping to
That's
get that started.
that is awesome.
Mhm.
All right. So for you, you've alluded to it a couple of times, but really talk through how that partnership with PBT and in the beginning and now has really impacted you and your schools.
Yes. I think one of the biggest impacts has been how much quicker we can identify and address vision
Mhm.
issues. Before, it could take weeks or even months for a
Mhm.
student to be screened and then referred and then to actually get their glasses, if it happened at all.
Yeah.
But with Prevent Blindness Texas, we're able to screen huge groups of students so quickly and efficiently and get those referrals out and communicate with those parents. I think what's even more powerful is how fast we can move from like screening to referral and getting those glasses in the hands of those kids. And then they come to school and they have their new glasses on and they're so excited. And then they're ready to learn. And it makes even a difference in the classroom.
Yeah. Yeah. So do you have a couple of students, that stick with you, that their story sticks with you, going through the screening and what it did, how it changed for them?
Oh yeah. Actually, my personal story, my son, he was in third grade and he just started getting these headaches. And so
Mhm.
I called over to the elementary nurse and I was like, hey, would you mind just checking him out today? Because he has been complaining of these headaches every day. And so she ended up calling me back and saying that she screened him and he failed his vision screening. So I knew I needed to get him in and get him
Mhm.
glasses. And after getting those glasses, just the headaches have gone, they're disappeared. So that was pretty amazing.
Yeah.
And then back when I worked at the primary school, we had a student, the teacher was like, he can't focus. I don't know what's going on, but I can put this paper in front of him. I can tell him to look at the board and he just will not focus. Something's
Mhm.
going on. We screened him, failed horribly. It was really bad.
Yeah.
Got him glasses. We got him actually hooked up with a local hospital because he needed resources at the time. And he got those glasses and he's just a completely different kid in the classroom.
Yeah.
And that happens a lot, very frequently.
Yeah. It is amazing. I mean, literally how a pair of glasses,
Yes.
right? There's so much more than just a pair of glasses. Right?
Yes, they
Yeah. Yeah. So do you think so currently for
Mhm.
our seat right now, we do odd years basically starting, in pre-K going through seventh grade. We used to do ninth grade students. And then somewhere along the way, I think it changed because I think the thought process was sophomores, they're getting driver's license, they're getting their eyes tested. So there's one more chance, right? But we know now that a lot of kids have deferred to getting their license. So do
Mhm.
you think that bringing back screening, at least in ninth or 10th grade, would be helpful?
Absolutely. Absolutely. Being here at the high school, I have several students that come in and they're like, Nurse Summers, I can't see. I can't see. And I will screen them and they will fail. And then I need to get them help. I need to get them glasses. But I definitely think we need to have a mandated screening in high school.
Yeah. Yeah, I think times, and that's the way healthcare is, right? It
Mhm.
evolves. But for us, we have really seen that need, at least for freshmen. But eyes change as you grow too. And of course, most kids are hitting, right, their growth spurts in early in high school. So we really have focused on, for schools that need help, or that want to have their kids screened. We have focused on at least, helping, particularly with ninth graders, because I do think it's something that, it's a mess, because we just assume that they're going to do it, because they want to drive, and that's not the case anymore. Yeah, yeah. Um, what advice would you give to, school nurses to get involved in these kind of partnerships?
I think my biggest advice would be just to take the first step. What I've learned about Blindness Texas is I wasn't sure how it would all come together at first, but once I reached out and realized how much support they can actually provide, and you don't have to have everything figured out before you start. You don't. They will figure it out for you. They will help you. I would also say don't underestimate how doable it really is. The training is very much straightforward. The screenings are efficient. The outcomes are immediate. So if you're a nurse or a district leader wondering if it's worth the effort, I could promise you that it is. And the impact of catching vision issues early and getting kids the help they need is huge. And partnerships like this are just one of the little ways that you can make a big difference in the lives of your students and your community.
Yeah, I love that. So, how can you what advice would you give to your parents or the community to get involved? What do you want them to know about vision health, but also, in investing in eye health?
Yes. I think parents and community members play a huge role in making these programs successful. For parents, I think the most important thing is follow through. When you get a referral and it comes home, just take that next step to get your child glasses. And if you need the help, reach out. Reach out to your school nurse because we have resources and we have things that we can help that'll make a big difference. For community members, I would say get involved, reach out to your school, volunteer, join the PTO, just get in there and help because even volunteering, you can help us with our vision screenings. You can help bring kiddos down. You don't have to do the vision screening. You can also just help with logistics and moving and helping people get to where they need to go. And that is a huge help.
Yeah. Yeah. What else would you tell them in terms of vision health? What do you think parents don't know that you wish they knew about eye health, or taking care of their kids' vision or their own vision?
Yeah. Vision, it everybody needs to see, especially these little kiddos who are learning. So if your student is having like behavior issues or they don't want to do their work, they're not interested in looking at their paper, have their vision screened because it could just be something as simple as a pair of glasses and that's all they need and it changes their whole outlook on everything. They can see the world now, they're going to
Mhm.
focus now, they're going to get their work done, they're going to be able to pay attention. It could just be that one little thing that you're missing.
Yeah. Yeah. So true. It's so true. So, school nurses often serve as advocates for children and families.
Mhm.
How do you see your role, in that process, especially helping them access healthcare that they may need?
Oh, yeah. I think advocacy is one of the most important parts of my role as a school
Mhm.
nurse. Not every child has the same access to healthcare. So sometimes it takes us school nurses to step in and kind of bridge that gap a little bit. Um, one student, like I've said before, like the behavior issues, teachers
Mhm.
get frustrated. They come to you, they're like, I don't know what to do. We've already taken them to the principal's office. We've already done this. What can you do to help me? And just being able to get them a pair of glasses. If that's the issue, it's the change is incredible. But
Mm.
once they can see and everything's done and the teachers really see it, then I think the teachers really focus too on paying attention to the students in class. And then we get more, hey, Nurse Summers, would you mind checking this kiddo's vision for me? Absolutely. Absolutely. So just being an advocate and just helping them get connected to resources is a big thing for me.
That's awesome. That is awesome. What do you think would, in terms of helping teachers or parents know more about vision health, what do you think we can do to bridge that gap that would be helpful?
I think spreading the word,
Mhm.
education, putting it out there. Districts, we use social media a lot now. So even just posting out a little eye health information, even links to resources, anything like that is a huge help. We use Parent Square in our district, so
Yeah,
I'm able to send out messages and it's just a little text that the parent gets and they can open it and they can have all the resources right there, just at the click of a button.
awesome. Awesome. All right. Um, what if you could change one thing about the system right now, and since in terms of students and their health, what would it be?
If I could change one thing, it would be making health more integrated part of how we approach student
Mhm.
success.
Oh,
I
that's
think too
good.
often health is treated as something that's separate, almost like an afterthought, when in
Mhm.
reality, I think health is very deeply connected to learning and behavior.
Yeah.
So, like the student I mentioned before with the behavior on the surface, it looked like a discipline issue. But once we discovered the vision problem and we got him the glasses, everything changed. So
Yeah.
his learning improved, his confidence grew,
Yeah.
his behavior issues disappeared. So just take that's why I believe every school should invest more in preventative care, like
Yeah.
screenings, health education, partnerships with community organizations. And then when we catch those issues early, we're not just fixing a health problem, we're giving kids like a fair shot at success in the classroom.
Yeah. That's an awesome perspective. I love that. What message do you hope students take away when they come to see you? And I think I already know what it is, but what do you want them? What's the takeaway for them?
I hope that they feel cared for and they know that their health matters. And I want them to leave with a sense that someone actually listened to them and believed in them and took them seriously. And I think sometimes that kids think their problems aren't big enough, but I want them to know that if it matters to you, it matters to me and it matters to multiple people in the school. I want them to
Mhm.
understand that their health matters.
Yeah. You're an amazing nurse. I'm going to tell you,
Thank you.
your perspective is amazing. And I love your approach to taking care of the children and advocating for families, and advocating for vision screening, because I clearly think it's important.
Very important.
But I love the partnership we have, and the perspectives you brought today. Last question. Um, what do you want if people don't remember anything else from today's conversation? What do you want them to take away?
Um, Vision is very important. Vision is more than just seeing. I want them to know that I just volunteer, be more present, listen, and just take everything seriously. Don't brush anything off. Really dig deep into anything that gets brought up to you.
Yeah, yeah, I love that. I love that. Well, from all of us at PBT, I can say a big thank you to you for all that you do, for the students you serve, for how well you take care of them, and for being a great partner and a great advocate for vision health. We truly appreciate you.
So we truly appreciate you guys.
Well, we love what we do.
Amazing.
We have a great team across the state, and they believe deeply in supporting the nurses out there, and screening the kids and helping parents get resources, because we believe, I mean, vision is an important part of, to your point, right, to the learning process, to the journey through school. and all lifelong, right? I mean, if you live long enough, you'll probably have issues with cataracts, right? There's a whole range of things along the way that I don't, a lot of people don't know impact their vision and vision health. But I think that's another important part of, what we do, especially screening students because they learn early, right?
Yes.
Vision health matters. My vision health matters. This is how it ties in. They can understand the differences, to your point, that it makes across the board for them.
Yes.
And hopefully that stays with them too, right, for the rest of their life as they take care of their vision health. So that's an important piece of it too. So
Yes.
thank you. Thank you. All right. So big thank you to you and for what you shared today and the conversation. For all of you that are listening and thinking, I want to get involved with PBT, we welcome that. Be a part of our family, get trained, get certified, come join us at an event, go to your local school,
Yes.
support vision screening, right? There are all different ways to get involved with PBT and your community to support vision health and vision screening. But you can go to our website, preventblindnesstexas.org. We have all kinds of things happening, all different ways to support us. And of course, you can always donate too. But it takes all of us to move this mission forward. And so people like Nurse Summers are a key in making that happen. So thank you again. Thank you for joining us. And as always, don't forget to follow us, Eyespiring. And we always end with, we always want to know what your vision is. Thanks.